everyone, and welcome to the meeting of the Social Work and Health PDSP at West Lothian Council, and I'm Councillor Anne McMillan and I chair this PDSP. The meeting is being broadcast live and a recording will be available afterwards through the Council's website. I'm being assisted today by Alison White and colleagues from Committee Services and IT. Attendees may be joining the meeting from another location. Everything said while microphones live will be broadcast and recorded, and members are asked to be polite, respectful and patient. There is more information, including a privacy statement about meeting arrangements on the Council's website. An agenda has been published showing the business for today's meeting. I will introduce each item and a council officer will speak briefly about the report before councillors ask questions, have a discussion and make any decisions that are required. Councillors might leave the meeting from time to time when they have declared interests that prevent them from taking part, and there will be a pause while that happens and they will be invited back in for the next item of business. If the meeting is a long one, then it might be adjourned temporarily for a meal break or a comfort break, and I will see if that is going to happen. I'll just go straight on to the agenda, and just before I do, if officers have other commitments after they've presented the report, then they are free to leave if they wish to do so, obviously. Apologies for absence.
Chair, thank you. We have one apology today from Councillor Harry Cartmill, and if I can also confirm at this time, Councillor Damien Doran-Timson is online.
Thank you. Good afternoon, Damien. I'm just checking that you can hear the chambers.
Good afternoon.
Thank you. Any declarations of interest? I have one. That's a transparency statement that I'm employed by Kirstine Sullivan, Member of Parliament for Bathgate and Linlithgow. Any others? No. The order of business as is on the agenda. Item 4, minutes. Can we confirm the draft minutes of the meeting of the Social Work and Health PDSP? Sorry? Oh, Councillor Clark, sorry, I didn't see that coming up.
Yeah, it's just a small thing from the minute of the 6th of February. It says that Councillor Pauline Clark stated that she worked part-time for the constituency office of Angela Constance MSP and Cabinet Secretary for Justice. It's just it's just if we can have it either, I'm not exactly sure how I worded it, so it may well be that I said something that was inferred like that, but I don't work for the Cabinet Secretary, it's only in the constituency office, and I just wanted to make sure that that clarification was made.
Thank you. Thank you. Are we okay with the minutes then of the Thursday the 4th of December? Yeah. And the minutes of Friday the 6th of February, I think that was the ones Councillor Clark was referring to. Agreed. Thank you. That takes us on to item 5. The 2025-26 Financial Performance Month 6 Monitoring Report, and it's Neil Blair. Sorry, Neil.
Good afternoon, panel. The purpose of this report is to provide an update on the 25-26 financial performance of the portfolio of services covered by the Social Work and Health PDSP. The month 6 outturn position for the portfolio was an overspend of 1.008 million. This was part of the overall council budget position report to Council Executive on the 11th of November. The net outturn for the overall revenue budget at month 6 was an overspend of 2.588 million. Month 6 forecast for children's services is an overspend of 151,000, which is due to the recurrent pressure in external residential schools, with a significant demand for placements and increasing overall complexity. So this has been partially offset by underspends in staff costs. Month 6 forecast for adults and older people services is an overspend of 857,000, which is mainly due to further unprecedented growth in demand for commissioned care. and which again has been partially offset by underspend in staff costs. The month 9 forecast for the Council's revenue budget will be reported to Council Executive on the 3rd of March and will confirm a deterioration in the position for adults and older people. This is due to a further increase in commission care costs for increasing demand for services. And as noted in a recent report to Council Executive on the Scottish budget, the current pressure for commissions care for adults and older people services is estimated to be in the region of 2.9 million. I'm happy to take any questions on the report, Chair. Thank you.
Thank you, Neil. Thank you. Do we have any questions on the month 6 monitoring report? Neil, can I just ask, when we do the month 9 monitoring report, that comes back to this PDSP as well at some point?
The month 9 does not normally get reported to PDSP. It's usually only month 6 in the final outturn for the year.
Okay. It's just my interest is when you've said there was a further deterioration going to be noted on that. That's fine. Thank you, Neil. Any questions, Neil? Any comments? Thank you, Neil, for the report, and I'm sure when we do get another monitoring report, it's not going to be good news for us either. Yeah, but thank you. Thank you. Happy to agree the recommendations. Thank you. Item 6. Performance Report Quarter 3, 2025 to 2026, and it's Rob Allen, please. Thank you.
Thank you, Chair, and good afternoon. This report forms part of the regular reporting to PDSP and details performance for quarterly indicators up to Quarter 3 and provides an update on transformation actions. There are 8 performance indicators relevant to this reporting period, with the majority meeting their agreed target. Section 3 of the report provides information specific to the red and amber indicators, with full performance information detailed within the appended scorecard. Finally, Section 5 provides an update on transformation actions that support delivery of the Council's financial strategy, improvement and transformation outcomes. Chair, members are asked to note the content of the report, and either myself or senior manager colleagues would be happy to answer any questions yourself or members may have.
Thank you. Let's see if we have any questions for you, Rob. Any questions on item 6? Councillor Smith, Veronica?
Yeah, just some queries. It was just also to say, your transformation update, I've been finding that really useful. See what's happening and the progress. So I was thinking it would be good in other PDSPs as well. So one of the questions is to do with percentage of children and young people who contribute to my planning meetings. That's page 6 of the attachment. So it's about my planning meetings. So you've got current value 100%. So it's really good, their contribution. But I just wondered, is there feedback on the outcome of their my planning meetings? Is that collected?
So if there's feedback provided to children and young people and the families if they're not in attendance at the meeting, in terms of what was discussed at the meeting and in terms of future plans, which often, if they haven't actually been in attendance, they have contributed to.
Yeah, but do you get feedback about the outcome of that meeting, their views on it?
So the feedback discussion that took place at the meeting is discussed with the family and the young person, because it's their plan in terms of and responsibilities for taking forward any actions in that plan. So that would be shared with the children and young people and discussed.
Okay, thank you. And then there's another question at the... Right. Okay, so this is the transformational actions. So development of family-based care services. The progress bar is 100%. And it's really good news about the increase in inquiries for fostering and the approval of fostering families. I was just wondering, is it meeting your hope for target for foster carers and adopters at this stage?
Thanks, Chair. Yes, at this stage it is meeting the targets, and we do have predictions around deregistration. So in terms of the numbers of approvals, they've gone up significantly as noted, but in terms of overall numbers, because of the level of deregistrations, it took a while for that to start to rise, but it is rising now. So yeah, we are absolutely on target.
That's good.
We've actually over-delivered in terms of our adoptive families that have came on board with the service.
Good news. Another question is, Bairns House is 90% complete. So what is still to be completed? And also you mentioned that there's 9 young people on the waiting list for recovery support. And this is closely reviewed. So how long is the waiting list for? How long do they have to wait for this?
So in terms of the 90% completion, the final stages of this year have been testing out different interview sites. So most of the interviews are undertaken within the Jasmine Suite of the Civic Centre, and we've been looking at different sites within the community, and those are just being tested at the moment. So we'll be able to evaluate those tests by the end of March. The waiting list, so we have submitted an application for further years funding in recognition of the waiting list. We are requesting, our application also requests additionality of resource so that we can meet need and to prevent there being a waiting list. It's a matter of weeks, so we are working through that and people are not waiting too long.
Okay, thank you.
Thank you. Any other questions? Any comments on the report? Well, I don't see any. Thanks for this report, and as ever, there's some good news in the report and some progress on the various projects. I'll be happy to agree the recommendation. Thank you. Item 7, progress on implementation of a multidisciplinary team locality model. Karen Love, thank you.
Thank you, Chair. The purpose of this report is to provide an update to PDSP on the progress that has been made in the establishment of the multidisciplinary teams across West Lothian. Over the past 2 years, the service has progressed a range of activity to develop and implement a revised model of social work practice within West Lothian. Section 1 of the accompanying report provides a context around this activity, as well as in relation to the development of the model, as well as the achievement of the required savings. The revised service delivery model is constituted into 4 parts, and the accompanying report details information around each of those 5 elements and the work that has been progressed within each of the areas. Section 6 of the report details the progress on the implementation of the model, which has identified some challenges experienced through the implementation, as well as highlighting some of the positive impact that has been experienced by both employees and customers. Chair, in conclusion, I hope that members find the report helpful to the PDSP and it provides an update on the implementation of the model, and I'm happy to take any questions that your colleagues may have.
Thank you. Thank you, Karen. Let me see if we have any questions for you. Can I just ask, it's maybe in the report and it was a lot detail with that. Is there an end date for the implementation, if you get my drift?
Yeah, so I would expect that the full implementation has probably already come Indeed, we've implemented, we've got the teams aligned and we know where those teams are, but we're continually reviewing the model. We continue to develop that model because we recognise the importance that it's a new service, and essentially we recognise that we need to continue to learn as we kind of progress where we're going with that. So there remains a 4-weekly oversight board, which is chaired by senior officers, to look at that progress and what we're learning through the development of the model, as well as weekly models for weekly meetings for each of the constituent parts that are looking at how that has continued to be bedded in, and we're ensuring that we're meeting the needs of our customers.
Thank you. I'll let Councillor Smith in. Councillor Smith, Veronica.
Okay. It was just a query about feedback, the evidence for reducing waiting times for the necessary assistance for people to stay at home. Have you been getting good feedback?
Yes, so we're seeing some reductions in our waiting times, particularly around new assessments for care. So we're seeing that reduction. I think it's important that what aids that is within the locality model, the CMT meetings that are referenced within the report. So that shared multi-agency ownership of making sure that we get the right outcome for the person as timely as we possibly can. So whilst there might be a bit of a wait for an assessment, if there's an identified immediate need or an immediate risk, then we're able to deploy services into that.
And then just another query. So in 6.22, recognising that things are working well, but there's the identification of challenges, including service risks. I was just wondering what has been the biggest challenges in that.
So the biggest challenge has been around some of the recruitment for staff, because obviously how we managed the savings and the implementation of the model is we held vacancies so that we made sure that staff weren't displaced through the organisational change process of that. So we've then had to go out and recruit to posts, and whilst we've been able to fill those posts, the recruitment process takes some time. So the challenge has been mainly around that identified staffing, and that's particularly within the integrated access point as opposed to within some of the other locality teams.
Yeah, and I was just wanting to query because the review included 11.9 staffing reduction, so I just wondered how that fitted in with the issue of recruiting people. So was it different types of staff?
So we held vacancies back to allow us to reduce the posts, so we weren't displacing staff during that process, which is where the recruitment came from. And we lost 11.9 staff, as you rightly say, to allow us to achieve the required savings. And then we were able to manage that. Most of that was done through the rationalisation of some of our management structures. So some of our team manager posts, and in order to try and protect as much of the frontline practitioners as we could.
Okay, that's great. Thank you.
Councillor Lowe, Danny.
Yeah, thank you, Chair. I was just going to ask him, some of the model, is it based similarly on the district nurse teams who used to have locality plans that was split between East and West? Because it sounds kind of like it.
Yeah, so it aligns with the district nurse model, and there's district nurses that are aligned within our multidisciplinary locality teams, so they sit as part of our CMTs and an integral part to the...
It tidies it up so they're not having to travel from one end of the county to the other to go to a multidisciplinary team. Good idea.
Thank you. Any other questions? Any comments on the report? Don't see anybody coming in. Thank you for that, Karen. Are we happy to agree the recommendations? Thank you. Item 8, community occupational therapy service provision. And we've got a report and a presentation. I think it's Karen Love and Susan Reid. Thank you.
Okay, thanks very much. So hello everyone, my name's Susan Reid and I am the Group Manager for Community Occupational Therapy Services. Thank you for having me along this evening. Just give an update on the role and...
Sorry, Susan, can you just bring the mic closer to you? Thank you.
Is that better?
I think that is. There we go.
Okay, sorry about
the
that.
Acoustics. Okay,
thank you. So yes, thanks for having me along this afternoon to give you an update on the role and remit of community OT services and the critical importance and value that this service places on the health and social care partnership and also for those people that we work with within our local communities. So I thought I'd start off by sharing a bit of background to our service. So the principles of community OT align very closely with the Home First strategic direction. And basically what that means is that our main focus is working with people in their local communities to promote independence and dignity and to ensure that people can remain at home for as long as possible. So our OT service is split into an east and west locality so that we can ensure that we cover the full West Lothian geographical area. So our east team are based within Strathbrock Partnership Centre within Broxburn, and our west team within Armadale Partnership Centre. So this structure allows us to respond to local need and allows us to play an integral role in locality-based working. So we are one of the key disciplines within the multidisciplinary teams within the localities, and we work very closely with various services across the partnership. So we work across an individual's lifespan, which means that we accept referrals for children, younger adults and older adults. And we are a non-condition specific service, which means that we accept referrals for anyone who's experiencing a condition that's impacting on their safety or independence within the home environment. We also accept referrals from a wide range of sources, so professional referrals and also self-referrals. And this ensures that we give timely access to support for those most in need. Our waiting lists and our allocations are prioritised on risk and urgency. So again, we ensure that we target our resources most effectively. And we cover a range of assessments within community OT services, all of which are fundamental in preventing crisis and supporting people to remain at home. So in relation to our core objectives, our main objectives are to enable independent living, to prevent avoidable crisis, and to support both individuals and those who care for them. So in relation to enabling independence, as a community OT, we focus predominantly on an individual's strengths and their functional ability. And we look at how we can use those strengths and abilities into the area of an assessed need. And how we do that is we can change the approach that somebody provides to a certain task, or we can change or alter an individual's technique. And this can be done through the provision of aids and adaptations. We provide early intervention and timely assessment, which ensures that we prevent unnecessary hospital admission. And very importantly, we ensure that we prevent unnecessary premature formal care services or premature moves into long-term care. And finally, we place a strong emphasis on supporting carers and families. And this is predominantly through providing advice and guidance on moving and handling practices to ensure that we have sustainable care arrangements in place. So our vision within OT services is to establish a culture that embraces quality and customer care, promotes staff engagement and encourages collaborative working relationships. Now, this vision underpins how our service operates on a daily basis. And you'll see the values on the screen really guide how we deliver services openly and responsibly, how we invest in and develop a skilled workforce, how we work in partnership to avoid duplication and share best practice, and how we remain mindful of resources while still achieving meaningful outcomes for our service users. So in order to achieve this vision and our core objectives, we need to have a robust staffing structure in place. So you'll see on the screen there, we have myself as Group Manager, who offers strategic leadership and system-wide integration across the locality setting. We have 2 team managers, one based in the east and one based in the west, and they oversee operational delivery, performance and quality assurance of all work that passes through our service. We've got 15.6 full-time equivalent occupational therapists, and their main role is to deliver specialist assessment and interventions. And we have our 5 service coordinators who are critical in supporting workflow. They're the first point of contact for all referrals coming into the service, and they provide duty visits, all of which positively impacts on our waiting list management. So in relation to our core functions, you'll see from the screen there that we have 4 main functions within community OT services. So the majority of our demand and waiting list pressure sits within aids and adaptations and moving and handling assessments. And these 2 core functions have the most significant impact on a person's safety and system flow. And within community OT, these are the two main areas that we have responsibility for: the waiting list and management of allocations. We also complete assessments on behalf of other service areas in relation to housing assessments and independent mobility assessments. So in relation to aids and adaptations, as part of our assessment process, often the outcome of that assessment is to provide equipment or adaptations. So we can provide equipment from anything from basic standard stock, such as a bathboard to a toilet frame, all the way through to highly specialist bespoke equipment, such as specialist seating, which can support postural management. We also provide minor and major adaptations, so minor adaptations such as grab rails or banisters, which can be critical to prevent falls and unnecessary hospital admissions, right through to major adaptations such as stair lifts, ramps, through-floor lifts, and often extensions for ground floor, wet floor shower areas. Now, all of these outcomes really require our staff to be extremely knowledgeable and have a sound knowledge of building design and building regulations. And we work very closely with building services, external contractors and architects to ensure that any adaptation that we install not only meets current need, but also long-term need to ensure that somebody can remain at home for as long as possible. We also complete moving and handling assessments, and moving and handling assessments are far more than managing risk. These assessments really balance safety with independence and dignity. And without proper assessment, many of the people that we work with would become bedbound, losing mobility, independence and quality of life. So our occupational therapists provide clear professional guidance, and all of our OT staff are trained in risk assessed training. And basically what that means is that we reduce the reliance on two carers where it isn't clinically required. And this has a significant benefit on the client-carer relationship and also the capacity and flow within our care at home service. As I said before, we complete assessments also on behalf of other service areas. So we complete housing assessments, are also known as property needs assessments. And this is basically when somebody applies for rehousing. If there's a physical or mental health need that impacts on their accommodation, a request comes through to community OT for us to go out and complete a property needs assessment. So we will visit the individual in their home environment and we'll assess that individual's needs as well as their environmental needs. And if we feel that an alternative property is required, we will place a property type restriction on that individual and progress all of our findings back to housing allocations. And this enables them to match that individual with an appropriate property which will meet their long-term needs. As well as this, we also provide independent mobility assessments, probably better known as blue badge assessments, and we complete these assessments on behalf of the Anti-Poverty Service. So again, the Anti-Poverty Service complete a desk-based assessment, and if they feel that further assessment is required, in order for them to award a blue badge, they will pass that request through to community OT. So we complete 10 independent mobility assessments per week, and we complete these face-to-face within Strathbrook Partnership Centre. These assessments take into account the distance an individual can mobilise, their safety, their pain levels, and the impact their mobility has on their daily living. Again, we'll pass this assessment back to Anti-Poverty Service, and this then informs whether a blue badge can be awarded or not. So up on the screen there's just a rough guide in terms of our assessment process. So this relates predominantly to requests for aids and adaptations and moving and handling assessments. So all of our referrals will come in via the integrated access point. And within the integrated access point, we have our service coordinators who are knowledgeable and experienced and are the first point of contact for all calls coming through for community OT. And this allows us to really give appropriate information at that first point of contact. And we'll do as much as we can at that first point of contact to support that individual. If we feel that a further comprehensive assessment is required, this will get passed through to community OT services. And our team managers will screen and triage every referral that comes into our service. If we feel that that person is requires an urgent assessment or is at a high risk, we will always see that person within 5 working days. Mostly if somebody is at risk, we can see them within 24 hours. If we feel that somebody risk is managed and there's other alternatives in place, we will place that individual on our waiting list. And our key performance indicators within community OT services are for 6 weeks. And currently, and I should say since mid-2025, we have seen every individual within a 4-week period. So the outcomes and recommendations from that assessment may be the provision of aids and adaptations, signposting, or advice and education. So finally, one of our main objectives is to help people understand what to expect from our service. So OT assessments are used to understand need, risks and strengths so that outcomes and interventions are proportionate and appropriate. While we work collaboratively and value people's views, assessment findings guide decisions and alternatives may be considered. So for example, we often receive referrals into the service for a provision of a stair lift. However, this may not be deemed appropriate where cognitive difficulties are identified and that could impact on safe use. And if this was the case, we would then work with that individual and family to look at a suitable alternative. We also often get requests for handrails on external steps, and again, this may not be appropriate where a safe alternative access is already available. So what we're doing is to help people to understand that OT support is assessment-led. The focus is on proportionate support, and alternative approaches may be explored. And that brings me to the end of my presentation. So, any questions?
Many thanks. Let me see if we've got any questions. Councillor Logue, Danny?
Thank you, Chair. Just want to ask a couple of questions. I mean, I noticed that the using the service over the last while, it's really, really quicker. It's really slick, and most of the things you deal with are dealt with in the week, or even days. I find that quite astounding. What difference have you doing that's speeded the process up so much?
I think what we've done is we've got the right people in the right places. So we've got staff that are taking the phone calls at first point of contact, and we ensure there's capacity that allows those staff to go out and deal with high risk situations. And it might even be that we're just going out in the interim to provide short-term piece of equipment while somebody waits on our waiting list for a more comprehensive assessment. We've done quite a lot of other sort of waiting lists, sort of proactive planning. So we've done bathing stations where people can come into the service to look at their bathing needs and bathing assessments rather than workers going out to a property. So we've done quite a few initiatives over the last year. But I think ultimately it's really about having the right people in the right place. And I think it's really about screening and triaging and giving that really important critical information right at the starting point. So yeah, I think that's how we've managed over the last year.
Yeah, this is one of the clients I met recently who thanked me. I think he was assessed for homelessness and rehoused in a proper kind of accommodation required because his medical conditions within 3 weeks, which I found absolutely astounding. The other one I was going to ask you was the blue badge. I mean, the assessments of the blue badge are somewhat changed. It's more difficult to get one. I've noticed. I found even though all the medical issues probably point to you would normally get it hands down, and then it's a catch-22. There's some issue with it. It's came in that wasn't relevant before. Thanks very much.
Thanks. Brian?
Susan, do you give training to people who require the use of a hoist?
So we give training to our staff. That's who we're responsible to train. And our formal carers also get training through their moving and handling. We don't train informal carers directly. What we do is we go out and train in the use of the hoist and equipment. So we can go out and give advice and guidance in terms of the use of the hoist, but no, we don't specifically hold sessions for informal carers, because what we find is that we actually have to focus on the environmental needs as well. So we will go out individually, and yes, if there's an informal carer, we will support that individual carer within the home environment to understand that piece of individual moving and handling equipment that's been provided. Does that answer your question?
Yes. Do you monitor the progress of people I'm thinking now of someone that has a short-term issue. For example, they may have a hip replacement and require a particular piece of equipment. Do you monitor those? And then once that person doesn't require the equipment, that equipment can be withdrawn, or do they have to inform you that?
Yeah, that's a good question. It's really dependent on the situation, I would say. If we feel that somebody is capable of making that contact and letting us know if there's a change in need, then that responsibility would sit with that individual. If we feel that we need to do check-in visits, then absolutely we will ensure that we risk assess that person at that point. And if we feel that we need to be going back in a 6-week period or an 8-week period, we will arrange that directly with the individual. So we don't have a set timescale for seeing people. It is very much based on the individual circumstances. But no, we wouldn't just shut down an individual's case as it was once equipment was provided. If we feel follow-up's required, we will absolutely take that on board and complete that piece of work.
Do you get any input from other services? I'm thinking now about the ambulance service. Do they provide any input as to people that they may come into contact with?
So, the ambulance service can make referrals into the integrated access point. And if at the integrated access point they felt that referral was suitable for community OT, that would be passed on to our service. So that's how that workflow would come into our service area.
Thank you.
Thank you. Councillor Clark, Pauline.
Thank you, and thank you for the presentation. It was really interesting. And I suppose it's kind of a wee bit of an odd one, and I think it kind of ties in a little bit to what you were saying. Occasionally, your service might say to somebody, you need 2 carers, but I'm aware that sometimes that can be quite difficult then for care packages to be established quite quickly, because having 2, it can just be difficult in certain areas. If in that situation there's an informal carer in the family, is that taken into consideration? Are they allowed to be the other person that's in the care package, I suppose?
Yes, they can be. But that again has to be risk assessed, because obviously we need to ensure that the informal carer's safety is paramount, and we need to ensure that they are able to carry out that level of moving and handling. So the basic answer to your question is yes, but it all comes down to risk assessment of the individual.
Any other questions? Councillor Collin, Tom.
Thanks, Chair. Can I maybe just go a wee bit deeper into the blue badge situation that Councillor Log mentioned? And I do appreciate part of the background, as I understand it, during COVID period where there was no personal assessments, it was almost a blue badge was issued because of that. But now that these are coming up for renewal, that's where there now seems to be an issue. And it's just, we're working with national guidelines set by Transport Scotland, responsibilities anti-poverty service, occupational therapy is involved in that process. And I think there's a frustration by individuals who their condition has deteriorated, but it almost seems to be a process that has to be gone through. And the advice that I've been given to individuals is you ask for a face-to-face personal assessment, which I have to say, so far, I've got 100% record. And it just seems to be that there's a process there which seems to be trying to prevent a blue badge being issued rather than meeting that person's need. Is there something that could be done in the system to get that information that somebody's condition medically has deteriorated? It could actually help speed up blue badges being issued quicker to people who are in, and I would say, in genuine need, because I hear stories of individuals who are singing and dancing going down the street and they don't seem to be disabled, but there are hidden disabilities. I accept that. Is the system actually, I'm not going to say fit for purpose, but does it help to deal with the number of applicants quickly enough? I'm sorry if that is a long rambling question.
Well, it's not at all. So basically, when somebody's condition deteriorates, that information can be shared at point of reapplication, and that's really important. And I think that information needs to get sent out wider to the public to know that when they're applying, the greater amount of information they can provide, the better for their application. So if there has been a deterioration, any medical records or medical information shared at an early point does support that desk-based assessment. And again, when the individual comes through, and I can only speak for occupational therapy assessment, when the individual comes down through to our service, prior to that individual being assessed, we will go through and we will review all of our notes that we have on that individual. And if, for example, we have seen somebody recently for a different reason, and we feel that we've got enough evidence to support that the provision of a blue badge, we will use that and pass that back to the anti-poverty service. So we're trying to use the information that we have to support people. Now, that's all I can really say on that, I think, at this point.
Yeah. Is it the guidance that's not maybe clear enough what people need to provide, that they have deteriorated, rather than they're applying for renewal? Because it was only yesterday it was confirmed to me by a constituent that they have now submitted their third application for a blue badge. So that's really what I'm trying to say is the information there for people to make their own assessment that their condition has deteriorated, that they should be making it, and they need to provide that for yourself to allow yourself to make that decision quicker and better, I suppose, from them as an individual. So is the guidance clear enough?
I think the guidance doesn't come out from community OT services, so I think what we would do here is absolutely note that point and pass that on to the anti-poverty service so that we can actually review exactly what information is being sent out to ensure that that is clearly highlighted within that information.
Okay, thank you.
Thank you. Councillor Smith, Veronica.
Right. Yeah, just a query on the staffing structure. So do you believe that there's sufficient staff to function effectively, both to prevent people going into hospital and getting out of hospital as quickly as possible? It was good to hear that they're only waiting 4 weeks for assessments. But is there other factors at play? Are you working at optimum level of staff?
I'm working at my full remit of staff, so I work with the resource that I've got. I think all service areas would always want more staff, but however, what we do is we ensure that those staff, as I said previously, are in the right place at the right time to be able to manage the demand on our service areas. Within Community OT, our main focus is on the Community OT waiting list, and as I said previously, that's in relation to aids and adaptations and moving and handling assessments, because that is the key components of risk. So yes, in terms of our staffing numbers to be able to manage that part of the service, yes, I do feel we have adequate staffing. We then complete the referrals and assessments on behalf of other service areas, and we can provide the resource to them that we have. So at this moment in time, as I said, we have the full complement of staff and we have no vacancies in the service just now. We're fully staffed and we are managing to see people within our key performance indicators, which I feel is a good news story. Yep. So yes, at this point, I do feel that we are meeting our capacity.
Yeah, and just a couple of things about the core functions, your aids and adaptations. So how long do people wait for the necessary equipment? And the housing assessment, there is a shortage of appropriate housing. So is it better to modify homes? Because, you meet people that have been waiting for years for a more appropriate house. So just questions on that.
So in terms of our standard stock equipment, depending on the urgency, we can have that out next day, or we'll have it out within the week. If it is a specialist piece of equipment, that really comes down to contractors' timescales. So it really depends on what we're talking about. In terms of major adaptations, again, our assessment can be done within the matter of weeks that I've already given you. But in terms of ramp contractors, stair lifts, building services, these timescales all sit out with the service responsibility, and we don't have any ability really to bring forward that timescale. We can just work with people and contractors to ensure their safety in the short term whilst adaptations are taking place. So I can't give you a specific timescale because every single adaptation carries its own long timescale for stair lifts. Stair lifts, we can say, normally occur within 6 weeks. So there are timescales for stairlift companies that will give you an actual timescale. But for bigger pieces of building work, that's really dependent on the contractor.
Yeah. The housing assessments.
So housing assessments, we complete 25 assessments per month, but I can't go into the timescale for housing because I don't manage the housing stock.
Yeah. And just one final question, because I've had queries about mobility scooters from elderly people that they're finding these scooters, it keeps their independence and go to the shops, etc. But they're finding that when they try to inquire about getting ramps for them, they say, well, if you're in a wheelchair, you get a ramp, but you wouldn't for a mobility scooter. I was just wondering about that.
So we provide ramps for people that are either a permanent wheelchair user or require a wheelchair for a distance. So it's an assessment of an individual getting in and out of their property and the risk associated with that. If, for example, somebody was a wheelchair user or required a wheelchair for longer distance, but their preference was a mobility scooter, we would absolutely take that into account. But what we also need to take into account is the mobility scooter at times won't fit within the property. So we have to educate people in terms of that. At times, some ramps won't accommodate the weight or the width of a mobility scooter. So again, we have to educate people around that. So it's not just a blanket, no, we don't provide. It's round about gathering all that information to inform the best decision for that individual. And that takes into account what their access looks like, what their internal home environment looks like, and actually what their mobility needs are. Because one of the biggest things for community OT is that we don't want to take away any function from an individual at an early stage. If somebody can continue to manage their steps for longer, that is what we try to encourage, because as soon as we remove that ability, we can decondition somebody fairly quickly. So there's a lot of factors at play, but it's not a blanket no, it's just that we have to take a lot of other things into consideration.
Thank you.
Thank you. Brian, you want to come in again? Another question?
Yes, please. Susan, am I right in saying there's no short-term provision for blue badges? I'm thinking now about someone who has an operation for hip replacement, where the blue badge facility would be ideal, but there's no facility to allow a blue badge to be issued on a short term. Am I right in saying that?
You are right in saying that, but I'd have to check the guidance again with Transport Scotland and with the Anti-Poverty Service in terms of can give discretionary blue badges, but not for an acute episode.
Right. Thank you.
Councillor Clark, Pauline.
Thank you. And I think it's a kind of a variation on, I think, the question that Veronica asked you, but you couldn't answer. So I'm not really expecting you to be able to answer this. But if you can't, I'll ask elsewhere. So I'll ask it anyway, just in case. And it's regarding the property restrictions. Do you know if that includes adaptable houses? So if somebody, you're restricted, but you can move into a house as long as it's adaptable. Do you know if we allow that?
What we can do is we'll put a PTR on a property, so it could say ground floor living only, or what we'll say is 2-storey property that can be adapted. So we know that when that individual is matched with that property, we will go back a step, we will go out and complete a property survey prior to that match being made, so we can ensure that that staircase or that access can be adapted to meet that individual's needs. So the property somebody's matched with doesn't necessarily have to be perfect to meet their needs, but what we need to know is that it can be adapted to meet their needs. So absolutely, we would stipulate that on the PTR.
That's great to know. Thank you.
Thank you. Any other questions? Any comments? You did attract a fair number of questions there, Susan, and that's because the report, it was very interesting and very informative, so thank you for that. Are we happy to agree the recommendations? Thank you. Item 9, the analogue to digital telecare transition update. Rob Allen.
Thank you, Chair. This report provides an update on the ongoing work to support the transition from analogue to digital telecare in West Lothian. Members will be familiar from previous updates that this work is required to ensure upgrades that are being progressed by communication providers across the UK do not impact existing and future telecare users. I am pleased to report that positive progress continues to be made, with over 80% of existing users transferred to a digitally capable alarm. In recognition of this progress, the Digital Office awarded West Lothian a Gold Level 1 in June 2025 and a Gold Level 2 in October 2025. The service remains on target to complete all transition activity within the required timescales of January 2027, with information available for individuals, their families and others on a range of platforms. Chair, the report contains a range of additional background information, and it is recommended that members note its content, and I am happy to take any questions.
Thank you. Thank you, Rob. Is there any questions? Councillor Clark. Pauline?
Well done to everybody for the rewards. And going back to when this was first getting talked about and we were discussing it in here, we had a lot of concerns about some people might not manage with this, or they wouldn't have the technology available with, they're having to update the type of technology of phone service, whatever they had in their house. How has that been? Have those concerns, they weren't needed, or have we come across any problems?
So to date, there haven't been any significant issues that have been experienced for people who had analogue equipment in the upgrade position to digital, and we haven't experienced any particular issues either in relation to the rollout of new digital equipment for new individuals in receipt of the service. There has been good communication now established between major providers and or local home safety service that lead on this particular activity, which has helped address perhaps some of the early teething problems that were that transitional arrangement. So as with any project, as it develops and rolls out, some of the initial challenges the creases have been ironed out essentially.
Any other questions? Councillor Conn, Tom?
Thanks, Chair. Rob, it's just an arithmetical one. The 83%, what does that actually represent in actual numbers? Would I be correct? And if I did the calculation, it's the 3,800 homes that have the potential to be telecare, and we are at 83% of that 3,000.
Yes, the number now is slightly more than 3,800 individuals or households that have it, so that's what the percentage relates to.
So yeah, and we're approaching platinum, whatever the price of platinum is nowadays. Whatever the price of platinum is nowadays.
I'm really sorry, I didn't catch it.
Whatever the price of platinum is nowadays.
Oh, I see. Yes, sorry, apologies. Yes, platinum is the next stage for us to move through in terms of the award, and that will be established at the point when we transition all individuals over and we maintain delivery of that digital platform through that period. Apologies for not catching it the first time.
That's fine. Thank you. Thank you, Chair.
Thank you. Any comments? Rob, congratulations on the awards to the teams that are in the transition. I'm glad it's on target because we have heard for other areas that there was some difficulties for various reasons. So I'm glad that we seem to be on target and heading for, price or not, platinum. Are we happy to agree the recommendation? Thank you. Yeah. Item 10, 16 Days of Action campaign update. Pauline Cochran.
Thank you, Chair. The purpose of this report is to update the panel on the activity and impact of the West Lothian 16 Days of Action campaign, which ran from the 25th of November to the 10th of December 2025. Section D1 sets out the background to the campaign and the publication of the activity report. Section D2 provides an update on the planning undertaken and the important role played by survivors. Section D3 notes the level of multi-agency activities which took place, and all full details of that are contained in Appendix 1. In conclusion, West Lothian have a strong multi-agency approach to the 16-day campaign, resulting in a wide offering of activities with significant community impact. The panel are asked to note the content of the report, and I'm happy to take any questions.
Thank you, Pauline. Let me see if we have any questions. Pauline, I would like to ask the 16 days action. That is, it's West Lothian wide, and how many agencies would you think is actively involved in it? I know you've gave us a very detailed report there, but I'm thinking that it's quite a lot of organisations and teams going to making sure the 16 days action is, well, it's successful. I just wondered if you had any idea just how many.
I couldn't be absolute on this, but I would say 10 plus. Right across West Lothian, and we have big involvement from our police partners, our fire colleagues, education, housing, social policy, anti-poverty service. We've got lots of representation for the third sector from different organisations. West Lothian Women's Aid are very big partners in the 16 days.
Thank you. Thank you. Any comments on the report? I'm going to comment. That's why I asked about the number of organisations, because it's such a detailed report. There's lots of good stats in it as well. And at the risk of, I think when I first seen one of these reports, they weren't maybe just as detailed as what we had. That was many years ago, I should say. So thank you so much for producing this one today. I'll be happy to agree the recommendation. Thank you. Item 11, Audit Scotland report on delivering the promise, and it's Pauline, yourself again. Thanks, Pauline.
Thank you, Chair. The purpose of this report is to provide the panel with information on the key findings from the Audit Scotland report completed in October 2025 on care experience and keeping the promise, and the implications for West Lothian. To note, I did provide a report to the panel on local activity in respect of the promise in October 25, therefore it is important to consider that report alongside this report today. Section D1 provides the background to the audit report and the areas considered. Section D2 provides the 6 key findings. Sections D3 and D4 provide both the overall local position and the 11 national recommendations. Of particular note is 4.4, which contained 3 recommendations for progression by local community planning partnerships. And Section D5 notes West Lothian activity in response to this. In conclusion, West Lothian continues to make significant progress in delivering on the priorities of the promise. This progress has been achieved despite sustained financial pressures, limited resources, and the increasing complexity of workforce and legislative demands. We will continue to focus on delivering effective and sustainable outcomes within that challenging environment. The panel are therefore asked to note the content of the report, and I'm happy to take any questions.
Thank you. Let me see if we've got any questions on Audit Scotland report on delivering the promise. I have one, and it's about the report, and I'm just wondering how, I suppose my question is on this, there's been a lack of clarity. It was page 93 on this item 3, a lack of clarity about the roles and responsibilities, and that was against new structures. Then the Promise Scotland, the Oversight Board, and an independent strategic advisor, they were set up to help deliver promise. Has there been any move to look at that and maybe check the complex governance arrangements in case it is, causing a hiccup somewhere in the system?
Thank you, Chair. Yes, we now work very closely with our Promise Delivery partner, and there's lots of work going on behind the scenes to make sure those three external governance routes are more aligned. We've got quite a lot of work in terms of the route maps that have been recently published, and some of that is to try and address some of those structures.
Thank you. Thank you. Any other questions on the report? Councillor Smith, Veronica?
Yeah, it was just, so what has West Lothian Council been able to deliver as part of the promise up to now? And what do you hope to progress going forward in the near future?
Thank you, Chair. There's been a significant amount of work which would be really difficult for me to detail just now, but happy to either provide a presentation or to provide more detail. There was quite a lot contained in the last report that I brought in October about the local activity. We have worked very closely with lots of partners. We have a well-established what's called PIP Leeds Network. It's the Promise Informed Persons Network in West Lothian. It's got more than 20 agencies represented in that space, and we all work very, very closely. There's been lots of work taken forward in relation to the family-based care recruitment, an increase in inquiries, etc. Lots and lots of work around hearing the lived experienced voice and developing our children's rights and their voice. There's been lots and lots of work around different pilots that we've considered. We're currently engaged in a kinship care housing pilot, looking at kinship care and some of the overcrowding issues that are being experienced. We've strengthened our national links, and we're part of a regional collaborative with a number of other local authorities where we share good practice. So yeah, there's lots and lots of activity that's continuously ongoing and monitored. This year we have launched our Promise Informed Person Advocates, which is a champion type role, and we've also launched our PIP Allies, which is the child version really of the advocate role, and we're also looking to strengthen our alignment with our corporate parenting board.
Thank you.
Any other questions? Any comments? Just on there, I suppose we did have that report in October, Pauline, for on the promise, and I suppose we could look to have another one on the work plan. West Lothian view with regards to what's ongoing work and what we're doing to deliver the promise. Thank you. Are we happy to agree the recommendations? Thank you. Item 12, West Lothian Corporate Parenting Annual Report 2024-25. Susan Mitchell, please.
Thank you, Chair. The purpose of the report is to update the panel on the Corporate Parenting Plan Annual Report for 2024-25, which provides progress during the year of the Corporate Parenting Plan 23-26. The annual report reflects the multi-agency work undertaken by partners in the Corporate Parenting Strategic Board and details the progress in each of the 4 areas: improving the quality of care and care planning, improving health and well-being of looked after children, raising attainment and positive destinations, and providing effective through care and aftercare support services. Each of these has a multi-agency work stream attached and the report to the Corporate Parenting Strategic Group to report on developments and outcomes. Work is underway for developing the next iteration of the Corporate Parenting Plan, which includes participation and engagement with children, young people and their families to ensure the plan and its priorities meet need. As recommended, the panel notes the contents of the report, and I'm happy to take questions.
Thank you. Do we have any questions? There's quite a significant amount of detail in the report. Now, I would ask, Pauline, is there anything that is significant that we should be concentrating on this that's maybe not going as far? I notice we've got the kind of red, amber, green. Is there anything that the service is finding difficult to keep on top of on that?
I would say that there's just a lot of developmental work across the 3 work streams, and there's multi-agency representation on each of those that take that forward. I think it's difficult to kind of pick one area. Just to touch on what Pauline was saying about the promise. We are looking to align the promise closer to corporate parenting and have the promise work feed into the corporate parenting board, which I think will assist that going forward.
Yes, thank you. Thank you. Councillor Smith, Veronica?
Yep. It's page 6, the main highlights and developments in the period 24 to 25. There's just a sentence where it says there has been focus on children and young people accommodated beyond 9 months with no assessed route to rehabilitation. I just wondered what that actually meant.
So it refers to timely permanence planning, and we're keen that that we have clear plans in place for rehabilitation home or permanent care planning onto permanent form of care. So it's to ensure that those assessments and planning for children are remaining on track. And some of the work that we've undertaken is tracking that to make sure that if there are any barriers to timely planning, that we're able to address those.
Yeah. No, I just wondered, so you mentioned rehabilitation home, so it's just not a terminology I'm aware of, so I just wondered what that was. Is it a...
It's a phrase used to talk about restoring children back to their families when they're in our care. Rehabilitation.
Does that mean they're going back to their families? Okay, that's great. Thank you for that. And then just another query. The improving health and well-being, it says about developing a single point of access for mental health and family support. So I was just wondering if this support was being accessed efficiently and how long is there any waits for?
I wouldn't be able to answer about wait times, but it's really been about developing a single point of information so that information is accessible for anyone that would want for accessing all health services and particularly mental health services. So for families and for professionals, that there's a point of all information being accessible for services.
And are they able to access the actual service, or is this just an information point?
It is an information point that we're looked at, yes.
So do you measure how many people get access to the mental health support?
Thank you, Chair. Yep, so it measures lots of data sitting behind it. So we have a QR code where all the services are on. So it tells all referral routes within that one QR code. Children and young people assisted us in designing it to make it as accessible and user-friendly as possible. We then measure all the data of all the people that access the sites and which particular sites, so we can get a printout of who's accessed what service and when they've made contact. So, but we don't measure the referrals because those go to the services specifically. We only measure the landing page, so when they've went on that services page to find out more information. But yeah, we do get data on that.
Thank you. And then I think this is last question. The mental health and wellbeing service mentioned about inclusion and support service. Currently, we're suspending referrals. So I was just wondering the reason for that, and is it back up and running, or?
So that's not a current position, and this is the 24-25 report, but it was for a very short period during 2024-25. It was just over a summer period where there were less referrals due to school holidays, but it did allow an opportunity for to clear a backlog of referrals and to create space within some of the work, and that's been resolved now, so there isn't any issue. Thanks.
That's great. Thank you. And then it was just a query about the literacy, about the aims for literacy level 5. I just wondered what level 5 literacy was. Their targets for looked after pupils achieving level 5 literacy.
I'd need to provide that another time. I don't have the education knowledge to provide that.
And then just the other one about the young people eligible for aftercare experience one or more episodes of homelessness. And it was 35 people out of 331. So I was just wondering, what is there extra actions that can be taken for young people that become homeless? Care experience.
So the actions that we're taking are really from an early stage, and some of that is preventative, that we're trying to put in place good planning for young people at the point through their care journey, and to prepare for leaving, so that that's an option that will be successful. And we try and put in place as much support as we possibly can at that stage to avoid any move on plans that are vulnerable. And that a lot of that is readiness throughout a through care process. It's trying to provide that early enough. And also at the point when young people move on, we try to look at contingency planning and support around that moving on. So we have a lot of support from third sector providers to support young in in, say, having supported arrangements about accommodation when they move on, and also being ready when they plan to move on to, say, a known tenancy.
Thank you.
Thank you. Any other questions? Any comments on the report? Thank you. Susan, on this, and I did realise when I was asking the question that I should have kind of referred to the fact, was there any ongoing? I didn't have problems with that, because the report is 2024-25. Happy to agree with recommendations. Thank you. Item 13, West Lothian HSCP Workforce Plan 2025-28. And Lorna Kemp's taking us through this.
Thank you, Chair. The purpose of this report is to provide an update to the panel on the development and publication of the new HSCP Workforce Plan for 2025 to 2028, agreed by the Integration Joint Board in September 2025. The Scottish Government requires health and social care partnerships to publish a comprehensive workforce plan every 3 years, with annual updates in between. Workforce planning is a key enabler for delivering strategic priorities across all HSCP services, helping us to address workforce challenges, identify opportunities, and develop local solutions to ensure a robust, sustainable health and social care workforce across West Lothian. The agreed plan is attached as Appendix 1 to the report and sets out the workforce challenges and opportunities to support a robust, sustainable health and social care workforce. The plan was developed through comprehensive engagement with staff across the HSCP, including senior managers, as well as the strategic planning group and wider partners. And Section 3 of the report provides a brief summary of this engagement. It's intended to complement and build on the individual workforce plans of both Council and NHS Lothian. The full list of actions identified to deliver on the workforce plan is set out in Section 13. The action plan identifies 3 overarching priority areas for the HSCP: our future workforce, with a focus on attracting young people into health and social care careers; thriving workforce, where we are prioritising support, development and well-being of staff, and engaging our staff and partners in a meaningful and consistent way. The agreed governance structure to deliver the action plan is included in Section 4.2 of the report. In conclusion, development of the new workforce plan for 2025 to 28 is complete, having undertaken a comprehensive engagement exercise with staff and partners, and the panel is invited to share any comments on the plan. Happy to take any questions. Thanks.
Thank you. Thank you, Lorna. Let's see if we have any questions on the workforce plan. Councillor Smith, Veronica.
Aye, it was just a query on staff involvement, because I noticed that there was 80 staff responded to the survey and that 5 attended the workshops, and I know you would have put a lot of work into those. So I just wondered how many staff were eligible to be involved in this.
So the workshops were open to all health and social care partnership staff, so those who were employed by NHS Lothian and all social policy staff. So that includes adult social work, children and family staff, and community justice social work staff as well. I suppose we recognise that the engagement around the workshops maybe wasn't so great. We did go out to staff following those workshops with a summary of the learning from those and inviting any further comment. And we made an offer to go out to team meetings as well. The plan is very much to engage with staff on an ongoing basis, so build in that more consistent engagement with how we can support staff, how we can look after their well-being, and collecting those views and having that two-way feedback and the forums to do that in place throughout the duration of the plan, and not just in the engagement to develop the plan. So we hope to engage staff further as we go.
How many staff is that? Is it around nearly, was it 2,000?
Well, off the top of my head, I can't tell you. I think maybe slightly something around that, Aaron.
So yes, I think it's slightly in excess of that. I suppose one of the things that Lorna was saying was that we have recognised that this is a particular gap. That the engagement that we did and the feedback we got back was people were saying, yes, that's all very well from an organisational perspective, although there's still work to be done. So part of the action plan, we want to make sure we've got a coherent approach to how we make sure we engage with people in a way that makes sense to them. The methodology that we used maybe wasn't brilliant for this. However, we want to make sure that we keep this plan under review and we learn from that, but also that we tie into the existing forums that are there and engage with staff almost on their terms. So we've got some work to do in relation to that.
No, I appreciate there's been a lot of work into this, and so it's just a pity there wasn't more people contributed. Okay, so some other questions. Sorry about this. Yeah, so they mention, this is in page 7, appendix 1, about career development and progression. So there was issues raised about the risk of losing highly skilled workers. So would the report be looking at how you would stop that?
So I think that's something that was picked up in the engagement, that there's some professions where there is a gap between a gap in, being able to develop those skills required to move into the next band or a more senior post in that pathway. So I think what we'd be looking to do as part of this plan is identify what those specific roles are and how we can fill those gaps to allow people to progress more easily into senior roles. One of the actions that we are about to commence is doing a bit of a wider skills audit across the partnership. So getting something out to staff to say, what are the key skills that you need in your role? What are the skills that you see as needing to progress? And what do those gaps look like? I think that would be the starting point.
Okay, another question. This is your action plan. I was interested to see about the increased number of work experience and apprenticeship placements in timescale March 2026. So just wondering how many apprentices that you have currently and how many are you hoping to offer moving forward?
So it's a little bit of a gap for us at the moment. We have we don't offer apprenticeships, particularly in the sort of NHS Lothian side of the partnership. That's something that we would like to work with our colleagues in the college and with our services as well, to identify where are those opportunities to put apprenticeships in place, and can we work with higher education to create that pathway. So there's a bit of work still to be done in terms of looking at that. Yeah.
Then another question, so about measuring success, there's quite a bit of reference to assessed through iMatter. So are you able to measure how many people are responding? Are the surveys done through that? I was just interested to know more about how that's measured.
Yes, so this is the tool that is used across NHS Scotland to measure staff engagement and experience. In previous years, we have issued that to teams, again, right across the partnership. So both NHS Lothian and social policy teams. We have had a couple of years where there's been a bit of a gap in that. So we're hoping that we might be able to resume that use of iMatter across the partnership this year. It gives a response rate, an engagement index, and it gives a breakdown of scores across a variety of themes, including how well people feel supported by their manager. Do they feel that their work has meaning? Are they contributing to the organisation? How visible is leadership? So there's a huge range of staff experience measures that are collected through that survey.
I think I've got one last question. That's going back to Appendix 1, page 19, about the changes for international workers in care. And you mentioned about within the care at home sector, 50% of those employed are employed through foreign sponsorship schemes. And independent older people care homes, 15% of staff are employed through foreign sponsorship scheme. This represents a risk. So just wondered how that was going to be mitigated.
I'm happy to take that question. Thank you. So I suppose what I would say is that we monitor that on a regular basis through Care at Home. It was a real opportunity for to stabilise that particular sector, and our care providers took that opportunity. However, we do want to make sure that we're monitoring that on the basis that where there is that risk, we recognise that it was a risk. We think that we're managing that risk, and we think that we're doing that in conjunction with our partners, but recognising that there are challenges that come up regardless of where that workforce comes from. But we monitor that through a 2-weekly meeting for Care at Home assurance and oversight, and we have that overview across the sector generally.
Thank you.
Any more questions? Any comments anybody wants to make on the report? Don't see anybody coming up. Thanks very much, Lorna, for coming along today for that. Are we happy to agree the recommendation? Great, thank you. Item 14 is the NHS Lothian Board meeting minutes for information, and the same for item 15. West Lothian Integration Joint Board minutes for information. And item 16, the work plan. And that takes us to the end of the agenda. Thank you everyone for your attendance today and your contributions. Thank you.